Soaring cases of respiratory syncytial virus in Quebec have pushed the positivity rate to 15% in Montreal and Quebec City. Weekly provincial surveillance data show positivity rates of the childhood illness hover just over 13% province-wide. This with slightly higher rates in the two cities and wide variation among smaller communities. It's several times the most recent federal positivity rate of 3.5%. The head of the pediatric emergency department at CHU Saint-Justine Hospital in Montreal actually spoke on this, and he says his emergency rooms are completely jammed with patients with respiratory viruses that are largely driven by RSV. Well, joining us now to give us more details on the situation and what exactly RSV is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back.
Great to be here, Nima.
So it looks like we've got another respiratory virus on our hands, Dr. Raut. So let's start with what exactly RSV is and how it affects children in particular compared to adults.
Right. So RSV causes these yearly outbreaks of respiratory tract disease in Canada, usually from late fall to early spring. It's one of the most common causes of lower respiratory tract illness in young children worldwide. Now, for most kids and most adults, what we see is simple cold, but children less than 2 years of age are at particular risk for more severe disease like bronchiolitis or pneumonia and may even require hospitalization. We know that there's underlying health conditions like premature birth, chronic lung disease, and congenital heart disease that can really predispose you towards severe RSV illnesses there.
And what do you think is contributing to this spike in RSV cases in Quebec in particular?
Well, what we're seeing is that RSV, being a respiratory illness, was shielded in many ways with a lot of the public health measures we had in place for COVID-19. We did notice there was a spike last autumn and again this year as young children were exposed again to more people. And a lot of these kids don't have that strong immunity because they haven't been exposed previously as well. And of course, their birth mothers may not have been exposed and have not been able to pass that immunity either. So it certainly is a complex issue. And what we're seeing is that lack of immunity is likely going to trigger a lot more cases coming in.
So how does the rest of Canada compare to Quebec when it comes to these cases, Dr. Raut?
Yeah, so it's interesting when we look at pre-COVID numbers, what we found that Canada itself was actually quite high with RSV, 18,860 RSV cases in the 2019-2020 season. So this is pre-COVID. Compared to the August 2020 to 2021, we saw 239 confirmed cases. So there was a huge drop because of COVID-19 measures. But it also shows us that we can get back to those levels, unfortunately, going up to a much higher number of 18,000 there. So Canada is still seeing a 3.5% positivity. I expect that's going to actually increase as well. And then we're going to see more in more high-risk communities like Canada's north, where we're seeing a much higher rate of admission for the infants in the Inuit population.
And are there any vaccines or maybe prevention treatments that parents can use for RSV?
Right. Unfortunately, there are no vaccines at this time there. So when you have RSV at home, what parents can do can really best manage the symptoms, fever medications, and ensure their baby's well hydrated. When they get a bit more severe, then you would have to seek medical care, usually in a hospital setting, where physicians such as myself would prescribe oral steroids or an inhaler to make the breathing easier. But if it gets worse, we're looking at things like oxygen, a breathing tube, or even a ventilator.
All right, Dr. Raut, so considering all of this, do you think officials in other provinces other than Quebec should be concerned or a little bit more vigilant for RSV?
I think so. I think we're seeing this at a time when emergency rooms across Canada are already struggling with wait times and staff shortages. And what we're seeing in this mix is another wave of respiratory illnesses and potentially requiring ventilators once again. So I expect that all provinces are going to experience a significant strain on that healthcare resource in general, and some provinces more than others, unfortunately, and they'll have to be a bit more vigilant there.
We've got a lot to be vigilant about, Dr. Raut. COVID, RSV, influenza. What kind of recommendations do you have for parents who may be concerned about all of this?
I think there's a lot we can do, and there's a lot we cannot do as well. What we do know about these respiratory illnesses, physical distancing, washing your hands, and wearing masks can reduce these respiratory burdens. And I think that's going to be the key here coming into the holiday season.
All right, Dr. Raut, always great having you on Forum Daily. Thank you again for your time today.
Thanks so much for having me.